treat pain, to help it go away. But sometimes what you're doing is making it worse. At 8:15, a doctor will be in our studios to discuss the right thing, the wrong thing, and how to make you feel better faster. In this morning's health report, controlling your pain. You know, when you're suffering, you want to do whatever you can to stop it, but there are things that you could be doing that might actually make your pain worse. Dr. Eric Moser is with Cornerstone Neurology, here to talk more about that. Good morning.
Good morning.
You deal with pain management, helping people to manage. At different times, everybody hurts. You've just got to figure out what's right and what's not so right, right?
Correct. Most people, you know, can deal with some normal pain, and after a little while, they will start to improve. But after a couple of weeks, if you're still not improving and getting worse, you may need at this time to access medical care, and that may start off first with your primary care physician. The next step after that is we try to figure out and come up with a diagnosis. Once we know what we're dealing with, whether it's a pinched nerve or painful neuralgia or headaches, at this time we start coming up with a treatment plan. And this is where the concept of the medical home really comes into play and becomes very valuable. The communication between the different doctors and specialists now is enhanced. We're working much more efficiently together.
Okay, let me throw some ideas out that these are things that people tend to do wrong. One of them, people try to tough it out. I've got a pain and oh, it's going to be fine. I think guys do this a lot. I try to tough it out. That's maybe not the right thing to do.
At first, that's the normal behavior that people will try to do. The thing is, when it's not getting better on its own, the natural history of pain is that we improve, the body heals up. When it's not doing that, then it's time to seek medical care.
Another thing is you see multiple specialists, and you say maybe that's not the right thing?
Well, people are doing this sometimes on their own. They're seeing different specialists, and they're not interacting together. If you're directed to the right one to start off the medical care to get that information, that's probably the best way to access medical care.
One of the wrong things you mentioned here, you're afraid to exercise. I thought you're supposed to take it easy sometimes when you've got an injury.
Especially with back pain, people's natural behavior is to lay down and to be inactive when it hurts. Well, it turns out that people do better and heal up faster once they're up moving around. Of course, listening to your body, knowing your limitations. When it starts to hurt, it's time to back down. But as long as you can get up and move with back pain and get around, you should be doing that because the muscles will weaken, the joints will stiffen, and you lose muscle strength.
It's going to take you that much longer to make that complete recovery. Listen, we are short on time. Thank you very much for coming in and talking about this. Very nice. I tell you what, there's a longer list. We've got that on our website too. As we said, some things are right and some things are wrong. You know, listen to your body and listen to your doctor too. We've got the list on our website, myfox8.com. Doctor, thank you very much for coming in.
Thank you. Appreciate it.